welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and I'm going to discuss about how money plays an important role in health management, and it's a huge burden raising risk of myocardial infarction. Money has become an evil entity that is responsible for loss of several lives, as the treatment affordability depends entirely on the money, along with sudden financial crisis causing heart attacks or many other diseases. At a time of increasing healthcare costs, patients commonly face substantial financial barriers to obtaining needed healthcare. In a recent study, the researchers have reiterated the fact that older adults with a severe financial strain had a greater risk for mortality 6 months after being discharged from the hospital for an acute MI. The study findings were published in the JAMA Internal Medicine Journal, wherein severe financial strain among older adults is associated with lower medication adherence, which may negatively affect the recovery for older adults following a recent MI attack. However, the relationships between financial strain and an acute myocardial infarction outcomes for older adults have not been evaluated as yet. Therefore, the researchers did hypothesize the fact that severe financial strain would be associated with elevated mortality risk following an acute myocardial infarction. Upon analysis, the researchers found that severe financial strain was associated with a 61% increase in 180-day mortality risk compared with adults with no strain. They observed no significant association between a moderate strain and an increased risk of mortality. It was basically confined to severe strains. They noted that the results were comparable when adjusting for sex among those with severe strain and those with moderate strain. Hence, it was concluded that financial strain for older adults is a growing concern and patient-level interventions are necessary, but probably insufficient to ameliorate the downstream consequences. Also, larger policy interventions like increasing affordable housing and addressing transportation barriers for older adults are likely needed to reduce the socio-economic inequities in care outcomes after suffering a recent heart attack. That's all for today. Stay tuned to Medical Dialogues for further updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.